And it says that states like Michigan take off the regulations that don't allow your citizens to find the best coverage at the best rate for themselves. Another plan that was in place that in my bill that I think is absolutely necessary, and that's to deal with frivolous lawsuits, tort reform. Not unlike, I appreciate that one, not unlike what we did in Michigan back in the 90s. We haven't seen people without hope of recourse in the courts for genuine malpractice. Just put a cap on non-economic damages. And said if we can't determine what a bad outcome is in relationship to an eye or a finger or an arm or whatever, or even a life, there has to be some cap there, unless there was true malpractice. And then the courts ought to be there for us. So deal with frivolous lawsuits. And then the final part of my proposal was to say that every individual in every household, if they went to the insurance agent and they got their binder and said, we are purchasing this at such and such a price, my bill at that time, which was 2 years ago, said they would get a refundable tax credit of $3,500 per person or $7,000 for a family. At that time, the average cost of health care insurance for a household was $10,000 to $11,000. Would have gone a long way toward at least getting comprehensive coverage. But if you stop and think about it, if we spread this across the nation and no one, including our early 20s family members, wouldn't have an excuse. They could still have their sound system, but they could go and they could have insurance on themselves, reducing the cost to emergency rooms, reducing the cost for uninsured citizens that the rest of us as ratepayers have to pick up. There'd be no disincentive to not have to have insurance and no incentive to not have insurance anymore. Now, since that time, that bill that I introduced has become the centerpiece for the Republican alternative that they took to the White House. They showed to the president numerous times as an alternative. They've added things that deal with pre-existing conditions, including a high-risk pool for people who just can't be insured, don't have the means to do it. A high-risk pool is put in place to meet the needs of that finite number of people in the United States. So those are things that can be done and would have been done at no expense, additional expense to the taxpayer. We're private sector based, and everyone could access that. Now that doesn't give government the control that they want. That doesn't allow them to deal with Medicare issues by reducing Medicare and doing away with a good extent of Medicare Advantage, the one part of Medicare that isn't broke, because it's private sector based. They couldn't do that. They couldn't have more and more people saying, government is really providing for me, so I'm going to have to support big government. I don't feel that way. I fear big government. I want choice. I want freedom to choose. And I want to be responsible. And I want to be respected for being responsible as a private citizen. And then I want to be able, because of that, to assist others in need voluntarily, as probably most of you in the room do, in significant ways as well. So, having said that, you know that I'm not just against, that I do have an alternative that was legitimate, and a legitimate alternative that could move forward in the process of repealing and replacing. And so now I want to hear from you. Whatever side you want to take, we ask that you would, if it gets too many people, if it gets a good group of people who want to speak, probably have a line on this side and a line on this side. We'll block people so we know the cue and we can go back and forth. I think we can start by simply, if you want to speak, raise your hand, wave it, and I see right over there, and we'll go there. Second one I saw here, I'll keep looking.